Well, tobacco company Philip Morris says there needs to be tobacco regulation change in South Africa. This comes after the U.S. Food and Drug Administration's landmark decision to allow the marketing of IQOS tobacco products. The company says that governments and public health organizations can regulate smoke-free alternatives to differentiate them from cigarettes in order to promote public health. Marcelo Nico from Philip Morris joining us this morning to explain what it is they want. Marcelo, very good morning to you, and I hope I got that right. It is IQOS, is it? Never heard of them before.
Yes, that's right.
All right, so tell us what it is you're asking for, and is this in light specifically with regard to what's happening around the COVID-19 pandemic and our ban on tobacco products here, or is this a general call?
No, this is a different call. It's a general call. What happened is that this is historical decision of the Food and Drug Administration in the U.S., where they granted for the first time a modified risk tobacco product marketing order to a heated tobacco product, to IQOS. So basically what they are doing, after reviewing 3 years, during 3 years, they review all the science that we have provided and the evidence from Philip Morris and from third parties, and they concluded that the commercialization of IQOS in the U.S. Will promote public health. Why? Because the scientific evidence that we have provided states that IQOS heats tobacco, doesn't burn it, that produce lower level of chemicals when compared to cigarettes, and scientific studies have proven by switching to these products, there's less exposure to the body of potential harmful chemicals. So clearly it's a different product versus cigarettes, and what the U.S. is doing is a progressive regulation where they consider that those products are different, then need to be treated different, and that's why it's a significant decision that the Food and Drug Administration have taken, and it's our call here in South Africa as well to review the regulation. Current regulation is dated. Was done at the time these products were not available in the market. So if you consider currently IQOS is considered a tobacco product, e-cigarettes are not regulated. So clearly there's a discussion that needs to be held in South Africa and can significantly benefit public health.
So how different are these IQOS products from e-cigarettes that you just mentioned? And we know there's been lots of concern, lots of debate about the safety, especially the harm that it does to the lungs and all of that. Just explain to us non-smokers what the difference is.
Well, first of all, what we need to say is any nicotine product is not risk-free. So that's the first thing. And these products are intended for smokers that otherwise will continue to smoke. So the first thing that needs to be mentioned. IQOS, what it does, it heats real tobacco. So there's heat sticks of tobacco, comes in packs of 20s. It's available, by the way, in South Africa, now currently banned. But what it does is by gently heating this tobacco and not producing a combustion or burning it, reduce significantly the production of potentially harmful chemicals. And what the FDA have done in the U.S. is confirm that the scientific studies have proven that then your body is exposed to a significantly lower level of these chemicals. So in substance, the tobacco regulation needs to prevent people from start using any nicotine product, should encourage smokers to completely switch, and that's the best option. But harm reduction in tobacco means that if there are scientifically proven products that are better for the smokers, then the smokers have the right to know about these products and choose what is better for them.
Yeah, well, Marcelo, with all due respect, and I'm sure there are going to be a lot of people out there who say, yes, you've provided the evidence, you've provided the research, but you have a stake in this. So why should we believe, what the research says when it comes from the likes of you to promote something that you have a stake in?
Well, I hear you completely. Well, the thing is, this is the Food and Drug Administration is the biggest organism that does this analysis in the U.S. and it's not the only governmental institution that have done evidence, have looked at the evidence and have concluded there's lower level of chemicals. Have been done as well in Germany, in the UK, in the Netherlands. So there's a body of evidence, third party, that is not only from our company that is mentioned in this. I think the main discussion is there's a different discussion that we need to have when it comes to tobacco that is not just about banning. We need to consider as well what are the alternatives for the ones that Otherwise, we continue to smoke. There's 11 million smokers in South Africa. There's 1 billion in the world. There's a great example of what has happened in Japan, where IQOS was introduced 4 years ago, and there's a drastic drop on the consumption of cigarettes due to the introduction of alternative products. So this is a discussion. There's something else, and there's something new thanks to the science and technology that are alternatives that needs to be regulated on a scientific-based regulation. That's our main goal.
All right. Well, I suppose now is not the time to approach our government about this. We have a complete ban on products at the moment, but it will be interesting to hear, what they actually do think about it. Thanks so much, Philip Morris. Philip Morris says Marcelo Nico there. Well, here's a look now at your Friday weather.